With you now on your Monday morning, and a new warning this morning about Ozempic and Wegovy. Doctors say the type 2 diabetes drugs, popular for weight loss, could cause complications for patients while they're under the knife. Anesthesiologists claim the drugs are slowing digestion down so much that patients still have full stomachs while they're sedated, even if they stopped eating for hours before surgery. Let's bring in NewsNation medical contributor Dr. Dave Montgomery. Hey, Dr. Dave, we know patients have been reporting, unexpected side effects like bloating, balding while taking these drugs. And now the American Society of Anesthesiologists say the drugs could cause complications during surgery. So would you first just explain Ozempic and Wegovy's effects on digestion?
Yeah, good morning to you, Marky. This is all new stuff, right? New experience with this. The way that the two drugs actually work so well for weight loss is that it causes what you have led into we call it gastric emptying. Gastric emptying means that the stomach slows down, and the advantage there is when the stomach stretches to a certain threshold, it sends a signal directly to the brain to shut down the appetite, to shut down the feeding behavior. And the benefit there is you don't start digestion and absorbing calories. But the problem with things like surgery, where we've all been told, hey, before a procedure, don't eat after midnight, don't eat certain things after midnight, that it's still in the stomach, and this can cause trouble during surgery.
And the stomachs need to be empty before most surgeries for breathing purposes, correct?
Yeah, so it's interesting. So some people will have a sort of a natural regurgitation or vomiting effect after anesthesia. The issue is if the stomach is empty, there's not very much to go back up. But even in situations where you're intubated or situations when you're not, if you've got food in your stomach, what may happen is that the food gains entry into your trachea, your windpipe, and that causes real problems. In fact, some people, the anesthesiologists, are concerned because we call it aspiration pneumonia. You literally can develop a process of pneumonia in your lungs, and people are ending up in the ICU. So very important.
Yeah, it could cause injury to the lung, also death, I know. But what's the answer here with all that information that you just gave? If you're someone who does take these medications, should you stop taking it leading up to surgery? Should you just stop eating or fasting, start that long before other patients are supposed to? What are you supposed to do here?
Yeah, I mean, for, physicians who, clear people for surgery, this is all very new to us, and we're having to learn on the fly here. I think what the anesthesiologists are going to do is help guide us, right? So I don't want people to just stop the medicines on their own. And there's some dangers here. We don't know what happens to the body for people who take the weight loss drug if you start and stop. We just don't know what would happen, and we know that there are some risks of stopping. For people who take the medicine for diabetes, this is really important. If you take it for diabetes, it's really good for diabetes. That's why we're talking about it now. We got on the scene for diabetes. You won't have a medicine or coverage for your blood sugar. If you go into a surgery with high blood sugar, you stand the chance of not healing fast enough and properly. You stand the chance of increasing your risk of infections. All of this is really, really important. So you've got to talk to your doctor about it. And the problem is some people aren't getting this medicine from doctors.
Yeah.
That's an issue.
Yeah. It sounds like if you have a procedure on the horizon, just be open and transparent with your surgeon about what's going on, what you're taking. Dr. Dave, always good to see you. Thanks for joining us on a Monday.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.